Hello all. Today we will have Gyneac lecture. In previous lecture we had discussed about PID. We had seen about acute PID. PID is pelvic inflammatory disease or diseases of pelvic organs or inflammatory diseases of pelvic organs. And in acute PID we had seen acute cervicitis, acute endometritis, acute salpingitis, acute oophorytis. Those conditions we had studied, and that phrase was acute. Difference between acute disease and chronic disease you must be knowing. Whenever the disease is at its initial stage, that disease or that condition is in acute condition, acute stage. Duration is about 4 to 5 days or within a week. Progress of that disease is at acute stage. And whenever disease or that condition or that complaint, these complaints are remain in that patient or complaints which are seen more than 10 to 12 days, that disease is called as chronic disease. So, condition which is present more than 10 to 12 days or even seen even after 15 days, that condition or that disease, that term is chronic stage. So, acute and chronic diseases. We had discussed about acute diseases, acute pelvic diseases. Now we will see about acute chronic PID, that is chronic pelvic inflammatory disease. In chronic PID, again these are the chronic inflammatory condition of pelvic organ. In that pelvic organs which are commonly affected are cervix, uterus, fallopian tubes and ovaries. So, chronic PID will be chronic cervicitis, chronic endometritis, chronic salpingitis and chronic oophorytis. So, these are the types of chronic PID. Now, chronic PID, main important cause of chronic PID is again it is because of the acute PID. Repeat patient with repeated history of acute PID, patient who have continuously or repeated attacks of acute PID, whether it may be acute cervicitis, acute endometritis, acute salpingitis or oophorytis. So, patient with history of acute PID, that is the first and important cause of chronic PID. Usually incomplete cure of acute PID will result in chronic PID. So, first cause is acute PID. Second complaint is sexually transmitted diseases which are usually seen at the external organ, but if they are not cured completely, that will result in chronic PID. Like we had seen gonorrhea and STDs, we had discussed and we had studied about STDs, sexually transmitted diseases. Lecture had been taken for you. So, these STDs which are not cured in complete form, that can result into the chronic stage or chronic PID. Next and important cause is tuberculosis, TB of genital tract, that also we had seen. So, TB which is not completely cured, that can result in chronic PID. Other causes are bacterial infections, viral infections, but commonly seen are bacterial and fungal infection which are not cured completely, that can lead to chronic PID. Patients with unhygienic condition, patient with improper hygiene, those patients can relate with the chronic PID. Repeated attacks of infections are seen in those patients, so that can be ultimately ends in chronic PID. So, these are common causes for chronic PID. Other important causes are surgical history. Patient who have recent surgeries like dilatation and curettage, D&C, patient with PSPV examination which is not done in proper condition, repeated PSPV examinations, D&C, copper T insertion, IUCD insertion in improper condition, unhygienic condition. Patient with recent pelvic surgeries, abdominal surgeries, investigative procedures like laparoscopy, laparotomy. Some patients with after delivery, abortion, delivery, after cesarean, after any abdominal surgery, appendix and other minor surgeries. So, these patients with recent surgical history, those patients can also have this type of PID, pelvic inflammatory disease. Focus remains in the abdominal cavity or in the pelvic organ, and ultimately that ends into the chronic condition that we called as chronic PID. So these are some possibilities or some causes for chronic PID. General conditions are hypertensive patient, diabetic patient, patient with decreased immunity. These are associated conditions, usually more prone tendencies for the infection. So this is about chronic PID and its types and clinical features, types and causes of chronic PID. Clinical features: usually chronic PID is associated with continuous fever, chills, low grade fever. Continuously patient have this low grade fever, chills, body ache, malaise, headache, nausea, vomiting. Because of the chronic infection in body, patient have all these types of common complaint, general complaint, but these are common. With chronic pain in abdomen, there is continuously pain, dull pain in abdomen. Along with majority of the cases, patient have offensive or purulent, foul smelling per vaginal discharge. There may be burning while urination, that is dysuria, painful urination, painful sexual relation. These complaints also can be associated. On examination, usually patient is in a toxic condition, so patient have anemia, signs of anemia, signs of shock because of pain, because of fever, because of this infection. Patient is usually toxic. So general condition is like that. Sometimes patient have hypotension, patient have bradycardia, that is decreased pulse rate, patient have fever, increased temperature. General condition is according to that, and per abdomen there is tenderness on touch because this is chronic condition. So because of the accumulation of pus and infective focus is seen from more than 15 days, 15 to 20 days. So patient have this tenderness on touch. Sometimes if there is large collection of pus, we can palpate the condition. So inspection is usually normal, but on palpation there is tenderness, and if there is large collection of pus, we can palpate that. PSPV examination is usually there is offensive and purulent discharge which is seen on examination, and there is enlargement of uterus, there is enlargement of cervix on PV examination. So these are common clinical features or common clinical findings of chronic PID. Investigation, we do the all routine investigations. As in acute PID also, we had discussed about cultures, various types of blood culture, urine culture or cervical culture we do for the culture is usually advised for knowing particular bacteria, strain of bacteria, so that we can decide our antibiotic. Whether it is a tuberculosis, whether it is sexually transmitted disease, or whether it is a simple bacteria or it is a fungi, so that we can decide our treatment. So cultures are advised: blood culture, urine culture, cervical culture. These are basic and common investigations. Laparotomy, laparoscopy, depending on the condition. USG, basic investigation, then laparoscopy and other conditions investigations we advise. These are general investigation we advise for chronic PID. Treatment for chronic PID, as it is a chronic condition and usually it is related with general health of patient. Patient is usually in initial stage or later stage in shock or toxic patient. So usually hospitalization and injectable or IV antibiotics, analgesics, fluids, IV fluids, they are advised. So usually hospitalization is required for these types of patients. In acute PID, usually oral treatment is preferable, or in some cases injectable antibiotics are advised, but usually those conditions subsides with the oral antibiotic and injectable antibiotics, but for chronic usually hospitalization is required. So that is just gross introduction about chronic PID. Now as we had seen about the types of chronic PID, we will see one by one the types of chronic PID. Now first one is chronic cervicitis. Chronic cervicitis, it means chronic inflammation of cervix, and that is the chronic infection or inflammation of cervix or cervical epithelium. Whenever there is chronic infection or chronic inflammation of cervical epithelium, cervical mucosal layer, because of the chronic infection, in introduction we had seen what is the difference between acute stage and chronic stage. Chronic, that means you have to assume that the condition is from more than 15 to 20 days. Patient is suffering from that condition and the period will be not less than 15 days. So in chronic cervicitis, that patient have chronic infection of cervix. Chronic infection of cervix, that means there is inflammation of cervical mucosa, there is continuous pus accumulation on the cervical mucosa, and cervical mucosa or epithelial layer is very delicate, and because of this infective discharge on that mucosal layer, there is desquamation, or the external layer of cervical epithelium is removed and the internal layer is exposed. And whenever there is exposure of inner layer, that again causes pain, burning. So that is called as cervical erosion. So little bit confusion in cervical chronic cervicitis and cervical erosion. Let me clear it. Chronic cervicitis, that means chronic infection, chronic inflammation of cervix. That means there is infection of cervix which is more than 15 to 20 days. That is chronic cervicitis. Okay. Because of this chronic infection of cervix, there is continuous pus collection or pus accumulation on the cervical epithelium, and because of continuous exposure of this pus or infective material, there is removal of external layer or external mucosal layer of cervix. And when there is removal of external mucosal layer, inner mucosal layer is exposed, and this inner layer is very delicate, and because of exposure of this inner layer, patient have lots of complaint like pain, burning, itching. So that condition where there is removal of external layer and exposure of inner layer, that condition is called as cervical erosion. Cervical erosion is again a short topic, so we will see cervical erosion. Now cervical erosion is the condition where there is desquamation of external layer of cervix and there is exposure of inner layer of cervix, and this cervical erosion is of two types, congenital and acquired. Congenital means in some babies it is present from birth, that inner layer is exposed and there is absence of external layer, that condition is congenital. But acquired condition, acquired cervical erosion, usually it results because of the chronic cervicitis. Patient with chronic cervicitis will have this cervical erosion. So these are main types, congenital and acquired. These are the types of cervical erosion. Now causes of cervical erosion, important causes infection, chronic infection of cervix, that is the cause for the cervical erosion. Second important cause for cervical erosion is excessive level or increased level of estrogen hormone, especially patients who are under hormonal treatment or patients who are taking OC pills, oral contraceptive pills, those patients have the chances of cervical erosion. So increased level of estrogen. So main two causes are seen, that is chronic infection of cervix and the estrogen, increased level of estrogen. These are the causes for cervical erosion. Types of cervical erosion, clinical types are papillary erosions. These erosions are like a papillae on the cervix. Follicular erosions, they are like follicle on cervix. Follicular erosions are usually because of the chronic infection or chronic cervicitis. Papillary erosions are because of the increased level of estrogen. And simple flat erosions. Flat erosions are maybe because of increased estrogen or maybe because of infection. So these are the three expressions of erosion: simple papillary erosions, follicular erosions, and simple flat type erosions. These are the three types of erosions which are seen on the cervix. These are the types of erosions. Clinical features of erosion or chronic cervicitis: a patient have white discharge or excessive discharge from cervix. This discharge is usually offensive, foul smelling and purulent sometimes, and it causes burning, pain, itching and pain during urination, that we called as dysuria, painful sexual relation, that is dyspareunia. And other complaints are patient may have low grade fever, pain in abdomen. Other common complaints of chronic PID can be seen in this condition. Investigation, we advise investigation are usually routine investigation with cervical cytology, cervical smear, pap smear. These investigations we advise for the cervical erosion and chronic cervicitis. Also it depend on the age of patient. If patient is more than 50 to 55 or 60, then chances of cancer of cervix is also should be considered, and investigations should be done according to that, and we advise pap smear and other things. So chronic cervicitis or cervical erosion at young age will require just routine investigations and cervical smear, cervical cytological study and culture. But if patient is at the high risk age, then we advise the investigations considering with the cancer of cervix like pap smear and biopsy, and if needed a CT scan and MRI scanning and MRI. These are the investigations we advise for erosion and cervicitis. Treatment for cervical erosion and cervicitis is proper antibiotic. Basically, advice for hygiene and other conditions should be given for all the infections. Particular treatment for chronic cervicitis is antibiotic, analgesics, and for cervical erosion, particular treatment is hormonal treatment, as it is because of the increased level of estrogen. If it is because of increased level of estrogen, we have to give progesterone hormone or anti-estrogen hormone. If it is because of the erosions are because of the infection, then we have to treat the condition with antibiotic, oral or injectable, or sometimes IV antibiotics. And nowadays laser therapy or other cryosurgeries or latest techniques are there that can be used for the treatment of cervical erosion. These are the treatment measures, or we do the diathermy treatment or cauterization treatment for cervical erosion. That is the latest treatment. Diathermy is used or cauterization is used to remove the remove the cervical erosion, or we remove the inner layer, or we do the cautery of inner layer, so that healthy external layer or healthy squamous layer can be grown on that exposed layer. So we do the diathermy treatment or cauterization treatment. Again, it is homeopathic topic, because in this condition we just give antibiotic, and for cervical erosion also, depending on the cause, whether it is hormonal, we give the other hormones, and if it is infective, we do the diathermy technique, cauterization technique, and homeopathic treatment can be work very well on the cervical erosion. There are marvelous remedies in homeopathy for cervical erosion. Cervical erosion is very common clinical condition. Usually patient comes with white discharge, excessive white discharge with pain, burning, and on examination we can see the layer, external layer is shredded off and inner shiny layer can be seen. That is particular of cervical erosion. Very easy to diagnose the condition. On just per speculum examination we can diagnose, because of the exposure of shiny layer of cervix. That condition can be labeled as cervical erosion, but we have to differentiate depending on the age of patient and history of patient. If patient have family history of cancer, previous history of any malignancy, investigations are changed, like we had discussed pap smear and biopsy and smear we can advise. But if patient is at healthy age, young age, and history of this type of condition, repeated history of white discharge and pain, burning, cervical erosion is the condition, and if we give homeopathic treatment for these condition, it can be cured completely. So that is chronic cervicitis with cervical erosion. Next condition is chronic endometritis. Chronic endometritis, like in acute endometritis we had seen, this is the chronic infection of uterine endometrium. Chronic infection is because of acute infection, as we had seen in causes of chronic PID. So patient with history of acute endometritis who had not taken complete treatment, or in some cases condition is not cured completely, that can result in chronic endometritis. So main causes or first cause is patient with history of acute endometritis. Second cause is patient with recent history of surgery like appendix, any abdominal surgery, delivery, D&C, abortion, cesarean, any surgical history. Corporate insertion, unhygienic examinations or unhygienic condition in patient. So these are some causes for chronic endometritis. It is a bacterial condition, usually bacterial infection is seen, and this condition is synonymously called as chronic pyometra. That means because of the infection, chronic infection of uterine endometrium, there is pus collection in uterine cavity, and because of the pus collection, as it is sticky in nature, the opening of uterus or cervical opening is closed and there is continuous accumulation of pus in uterus, and that condition is called as chronic pyometra. And when there is huge collection of pus in uterus, patient have severe pain in abdomen, patient have fever, patient have nausea, vomiting, patient can go in shock, and all the shock signs are seen. On examination, shock signs, that is hypotension, bradycardia, increased body temperature, increased temperature, and because of excessive nausea, vomiting, she can be in shock. On examination, inspection, there is sometimes enlargement of uterus depending on the pus collection in uterus. Enlargement can be seen. On palpation, tenderness, when we touch the uterine cavity, patient have tenderness. On palpation, again we can palpate the enlarged size of uterus, and it is very tender to touch. PSPV examination, sometimes discharges can be seen and size of uterus is enlarged on PV examination. Investigations, we do all the investigations, routine investigation plus USG, and if we can remove the pus from uterus, we advise for pus culture. On pus culture, we can confirm the bacteria, strain of bacteria. And treatment for this chronic endometritis or chronic pyometra, we cannot just treat this condition by giving some tablet, antibiotic, injectable antibiotic or IV antibiotic, because there is huge collection of pus in the uterus. So we have to remove the pus from the uterus. So we have to do the surgical procedure that we called as D&C, dilatation and curettage. Patient should be hospitalized, patient should be sedate, sedation should be given to patient, and under sedation we curate the uterus by dilatation of cervix. We dilate the cervix and curate and clean the uterus completely, and again patient is post-operatively managed with antibiotic, analgesics, proper follow-up care for removal of the infective focus. So these things should be advised for chronic endometritis. Next is chronic salpingitis. Chronic salpingitis, that means there is chronic inflammation of fallopian tubes. In acute salpingitis, there is infection of fallopian tube. Usually it results after surgical procedure, after infection of endometritis, patient with history of endometritis, or patient with STDs or tuberculosis, important is. So in chronic PID, again those causes are same, like patient with TB history, tubercular history, patient with surgical history, abdominal surgical history, patient with previous history of infection, patient with previous history of acute salpingitis. So these are the causes for chronic salpingitis. Chronic salpingitis is chronic infection of fallopian tube, and because of chronic infection there is again pus collection in the fallopian tube. Now you can understand, whenever there is infection in body, usually there is collection of pus. Any infection, whenever there is a lung infection, initially it is hydro type, I mean it is watery discharge, but when that condition settle down, and pneumonia especially, the term which is very common for us, that is pneumonia. So initially whenever there is a small patch in lung, it is a pneumonia, which is, we called it as a small patch of pneumonia or pneumonitis in lungs. But when it settle down, when it settles in or it changes in chronic condition, there is collection of pus, what we called it as consolidation of lung. That is just for the reference that we can see in lung infection, or if it is not treated in time, it can lead into lung abscess, that is collection of pus in the lungs. Like that only in obstetric also, whenever there is chronic infection in genital organ, that can lead into the pus collection. So likewise in salpingitis also, if patient have acute salpingitis, repeated infections, tuberculosis, previous infections, any abdominal infection, infection from uterus, infection from ovary. So these types of infection, whenever they are in chronic condition, that means it is seen from more than 15 to 20 days. Again there is accumulation of pus in the fallopian tube. So whenever there is pus accumulation in the fallopian tube, that is called as pyosalpinx. Initially it is hydrosalpinx. Whenever the discharge is watery, we called it as hydrosalpinx. And then we called it, whenever the discharge becomes purulent, pus like, we called it as pyosalpinx. So changes of chronic salpingitis, first stage is hydrosalpinx, then pyosalpinx, and then interstitial salpingitis. That means pus dries and becomes fibrosis. Okay. and this condition will lead to tubo-ovarian abscess. Tube and ovaries are fused, and the term is called as tubo-ovarian abscess. Sometimes this pus from the fallopian tube goes in the pelvic cavity from the fimbrias, and that causes pelvic abscess. Sometimes peritonitis, tubo-ovarian abscess, pelvic abscess and peritonitis. These complications can be seen with the chronic salpingitis if it is not treated. And tubes are, after that tubes becomes blocked, so patient may have infertility, failure of conception, because ovum cannot be transported. So these are the things which are associated with salpingitis. Clinical features: patient have nausea, vomiting, fever, there is continuous temperature with chills and headache. There is pain in abdomen, especially in iliac fossa, depending on the condition. If it is affected on the right side, fallopian tube of right side is affected, patient have pain in the right iliac fossa. If patient have pain, infection at the left side, patient have pain at left iliac fossa. If bilateral infection, then pain at the both iliac fossa, or pain in the lower abdomen. So patient have chronic abdominal pain, nausea, vomiting. Patient may have infertility, that is failure of conception. Patient have offensive or purulent discharge, PV discharge, that can be associated. Clinical features: patient, because of excessive pain and other things, may be in shock, so shock signs can be seen. Per abdomen there is tenderness on palpation because tubes are enlarged, and we can palpate them, but they have tenderness. And PSPV examination, on per vaginal examination we can palpate the tubes because they are enlarged in size, we can palpate them at the posterior fornix. If there is tubo-ovarian abscess or mass, that can be palpable. Investigations: we advise all the investigations with USG, if necessary laparoscopy. If we have any doubt about tuberculosis, investigation about tuberculosis are advised. Treatment is, again, it is a hospitalization is required. Patient should be hospitalized depending on the pus collection in the tube, or depending on the pelvic abscess or tubo-ovarian abscess, or whether it is a peritonitis. Treatment is decided. Usually surgical exploration or cleaning of abdominal cavity with laparotomy is advised. Laparotomy, that is cleaning or exploration of abdominal cavity with routine things, are done with proper sedation, and it is a surgical procedure, so proper care should be taken. After surgery, again post-op treatment with proper antibiotic, follow up with antibiotic so that proper removal of that infective focus from body should be done. So proper follow up should be advised. That is about chronic salpingitis. Chronic oophorytis, it is a chronic infection of ovary. It is because of acute oophorytis, because of this chronic salpingitis, acute salpingitis, any infection from abdominal cavity, peritoneum, because of abdominal surgery, previous history of any infection in body. These are some causes for oophorytis, chronic oophorytis. Clinical features are again same: fever, body ache, malaise, nausea, vomiting, pain in abdomen. Discharges are rare, but sometimes maybe per vaginal discharge. On examination, general condition will depend on the patient's pain, patient's temperature and other things. Patient is usually normal for oophorytis, but patient have pain in the abdomen. So on examination, tenderness at the lower abdomen, and PSPV examination, if ovaries are enlarged and there is tubo-ovarian mass or abscess, that can be palpable. Investigations, we advise routine investigation, USG, laparotomy. Treatment depend on condition. If it is, if it can be treated with IV antibiotic, we advise for hospitalization with IV fluids and antibiotic. If surgical procedure is required, laparotomy is advised. So these are the types of chronic PID, pelvic inflammatory disease: chronic cervicitis, cervical erosion, chronic endometritis, pyometra, and chronic salpingitis, that is pyosalpinx, and interstitial salpingitis, and this chronic oophorytis, that is infection of ovary. These are the different types of chronic infections of pelvic organs. So PID, chronic PID. That is a large topic. PID, pelvic inflammatory disease. It is a long question. In that we have to cover both these conditions, acute PID as well as chronic PID. So adjust your writing according to that, because this question is usually asked for a long question. Again, all these topics are also expected as a short note topic. So acute endometritis, chronic endometritis, acute salpingitis, chronic salpingitis, chronic the cervical erosion, these topics can be asked for the short note. So that is about chronic PID, types of chronic PID. That completes your PID, pelvic inflammatory diseases, various types of acute diseases and chronic diseases. Again, this is also a topic which can be cured by homeopathy. So you should have to go through all the homeopathic remedies for PID.